Trudy Mason sitting in for Elias Makos again this week. And in this segment, we are going to talk about the rising number of Quebec doctors who are opting out of Medicare, going into private practice. So the jump is rather worrisome, and some reporting by the Gazette has illuminated this for us. We welcome to the Elias Makos Show Aaron Derfel, the health reporter for the Montreal Gazette. Aaron, thanks for joining us.
A pleasure to be here, Trudy.
Tell us about the numbers that you turned up on this phenomenon.
Okay, so, for years in Quebec, the law has permitted doctors to opt out of Medicare. Instead of billing RAMQ, they bill patients. And it's been going up steadily, but last year it just jumped. It increased by 22%. It went from 681 doctors who had opted out to 780. And I also noticed that more and more specialists are opting out than in the past. I'm talking about orthopedic surgeons, dermatologists, but you also have urologists and cardiologists and gastroenterologists. So they're opting out, charging patients for a wide range of procedures. And I think it just speaks to several things, the fact that these doctors are fed up with the public system, with the lack of resources, with all the red tape, and they decided to go private.
Am I mistaken, Aaron, that certain doctors do have the ability to jump on and off, like in and out of Medicare multiple times a year?
Yes, and this is actually, some of my readers have pointed this out. I was actually going to look into this during the pandemic, but it was obviously, it was COVID-19 was a priority. But yes, under the Quebec rules, doctors can opt in and opt out. So what that means is they might spend 3 or 4 months at a hospital, and then the next 3 or 4 months they opt out, and they're working at, for example, there's a private orthopedic hospital in Laval, fully private. And so they opt in and opt out. And, the patients that they select for that private hospital, they're not the most complex cases. And if the patient ends up suffering complications, they have to send them to an ICU, as, for example, Cité de la Santé. So in a sense, the private system, they're cherry-picking the best patients. And if something really bad happens, they have to send them back to the public system. And this is an issue that perhaps the newly created agency, Santé Quebec, has to deal with, maybe RAMQ, that ability to opt in and opt out. So you can't straddle both systems simultaneously, but there's a loophole. You can go from private to public and back again as many times as you want.
I don't know whether I feel as angry about that as I do people, doctors just completely closing the door on Medicare and going fully private. But honestly, I can't fault them. We've heard for years and years that the bureaucratic burden on doctors is tremendous. And in the case of GPs, for example, there's all kinds of other expectations that they fill roles not only for their own patients in direct service to their patients in their offices, but, for example, in emergency rooms and so on. So do you blame doctors for doing this, for what you've learned about the healthcare system?
No, I don't blame them. I don't blame them at all. Doctors have contacted me from time to time to complain about all these bureaucratic rules. And as I was saying, orthopedic surgeons say, I'd like to operate on more patients. I can't because of the constraints imposed by the hospital, but I can do it in my private facility. And so that's how, in their minds, they're dealing, with the pressing problems. The problem with that is when you're looking at the big picture, what we're seeing, for example, with dermatologists, you have, I think it's something like, I don't know if I wrote, it was 38 dermatologists who have gone private, and now no, it's 41, and in the public system, it's impossible to get a dermatologist, and right now there are nearly 100,000 Quebecers waiting for their first appointment with a dermatologist. But if you can pay out of pocket or you have private insurance that cover it, you can jump the public queue and see a dermatologist right away. So in going private, I can understand on an individual level why a doctor would do that, but then the trade-off is that it ends up lengthening the wait times for consultations and for orthopedic surgery. So the wait time for orthopedic surgery has doubled in the past 4 years, and consultations for an orthopedic surgeon are now at 50,000, which is a record. So, and this comes as you have 38 orthopedic surgeons who've opted out, and there's no room, there's no slack in the system, and so every medical specialist who leaves has an impact. And again, the total number of doctors who've opted out, it's as a drop in the bucket. It's just 4%, but it used to be 2% just a few years ago. And again, it speaks to the tremendous pressure that's in the system, and with all kinds of unintentional consequences.
Well, we also have it. One of the things that's kind of irked me about the government's response to this as well is that they've tried to shame doctors. They've tried to say and you heard this a lot from various health ministers in addressing general practitioners, a lot of them who are women, saying you need to work more. Don't implying that they should not, for example, be planning to take off significant time after having children. You're expected to get back to work promptly because you owe it to us. And
yes, that's shameful. What you're talking about is what some people call the feminization of the medical profession, and you're right. It is shameful. They profess to take this into account, but there's a lot of blaming of doctors, and the government, to its credit, recently has tried to reduce some of the paperwork. But you'll recall, for example, Quebec still, for the longest time, was allowing or requiring the use of faxes, this outdated technology. Everything is slow. There are problems with electronic health records. It's almost like we're in the Stone Age, and the government is trying to improve things, but it's taking far too long for a lot of these doctors who are just saying, "I'm fed up. I'm going private."
Anything new from the province? Any new plan, any new ideas, proposals, initiatives, Aaron, on how they might counter this defection to the private system? I've written the story, so I'm raising awareness. I know that Radio-Canada and La Presse have written about this in the past. Is this a priority for the newly created agency, Santé Québec? That's going to be in charge of running Quebec's $60 billion a year health system. I don't think it's a priority. I think it should be on the radar. And I think that, one possibility is to close that loophole to opt out and then opt back in. But, if that were done, there would be a lot of doctors, say orthopedic surgeons, who would suddenly be very upset. And so there are really no easy solutions. The government, it was last year, Christian Dubé announced that he was increasing the number of spots in medical schools by 660 within the next 4 years. But, it takes 5-6 years to train a doctor at least. And so the impact of that policy change will only be felt 5 years from now. So in Derfel land, Aaron, how do you fix it?
Oh, I think that there was a right step to increase the spots in medical schools. I would have increased it by even more than that. There's also the issue of foreign-trained physicians. We've all heard the story of
they're driving taxis and not.
Yes, exactly, exactly. We could definitely. I know of cases where you've had foreign-trained doctors who've passed their certification with flying colors in Quebec, but then the last step is that a hospital has to give them a residency, and hospitals are refusing to give them residencies. So there's a certain degree of xenophobia institutionally, if you will. So I think this is something that they can streamline in accepting more foreign-trained physicians. Again, we're not talking about bending the rules. These are hardworking physicians who have passed their certification. They've had to recertify in Quebec. But that last step, to be given the residency, they're not given the residency, so they can't practice as a doctor. That's something that can be improved. And I would, as you were saying, if I could wave the wand, I would make it. I would make it not. It's not impossible. I would limit the number of times per year you could opt in and opt out. So I think that would be the ideal compromise, and that would improve the situation. But it would just still it takes time. Just as with the ER crisis, I fear it's going to get worse before it gets better. It's the same thing with the shortage of physicians and the number who are opting out.
I say Aaron Derfel for head of Santé Quebec. Thanks very much for your time, Aaron. I appreciate it.
My pleasure.
Aaron Derfel, health reporter with the Montreal Gazette.